Hi, my name is Abigail. I'm going to be your nurse today. Can you tell me your name and date of birth?
Katie Cross, 5/14/88.
Okay, I need to do a physical exam on you. Is that okay with you?
Mm-hmm.
All right, I'm going to ask you some questions and then I'm going to do some testing on you, okay?
Okay.
Can you tell me where we are?
I'm in the hospital.
And who's the president?
Joe Biden.
Okay, and tell me what brought you to the hospital. What's going on with you?
I've been short of breath lately.
Okay, what's lately?
About 3 days.
Okay, so what I need you to do is look right here at my nose,
Okay.
and I'm going to hold some numbers up on my fingers, and you tell me what those numbers are,
Okay.
okay?
2.
Okay. Next, I would like you to look at this pen
Okay.
and follow it with your eyes only as I move it, okay?
Okay.
Okay, great. Next, can you give me a big smile? Good. And then stick your tongue out. Good. Move it side to side. Great. And stick your tongue out. Say ah. Good. Can you shrug your shoulders and move your head from side to side? Good. All right. Next, I want you to squeeze my fingers as hard as you can. Good. And then straighten your legs out. And then push your feet against my hands as hard as you can. Good. Do you have any trouble with walking or balance?
No.
Okay. Go ahead and stand up for me. And walk from here to the end of the bed.
Okay.
All right, that's good. And then swap places with me.
Okay.
Next, we're going to test your balance. So what I'd like you to do is cross your arms.
Okay.
And when I tell you to, close your eyes, and then I'll make sure you don't fall, okay?
Okay.
All right, go ahead and close your eyes. I'm just going to time you for 30 seconds.
Okay.
Okay, great. You can go and have a seat.
Okay.
All right, next, can you take both your pointer fingers one at a time and touch your finger to your nose, both sides. All right, then straighten your legs out and take your heel on this side and press it on your shin on this side. Great, and then do it with this one. Great. All right, while you've got your blanket uncovered, I'm going to check your capillary refill here in your toes. And also check for any swelling. Okay, good. All right, next I'm going to test your sensation.
Okay.
And we're just going to do this on your arms. All right, so this is what this little cotton swab feels like.
Okay.
When you feel it, just say yes.
Okay. Yes. 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 Yes.
All right, now close your eyes and we'll do the same thing.
Yes. 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 Yes.
Okay, next I'm going to test your sensation to sharp objects, but I'm not going to hurt you, okay? You can feel it if it's actually that sharp.
Oh, okay.
Okay, same thing, just say yes when you feel it. You can keep your eyes open for this part.
Okay. Yes. 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 Yes.
Okay, now close your eyes and we'll do the same thing.
Yes. 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 Yes.
Okay, you can open your eyes. Now we're going to test your sensation to temperature.
Okay.
And you tell me if it's hot or cold when you feel it.
Okay.
Okay?
Cold. 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 Cold.
All right, now close your eyes and we'll do the same thing.
Cold. 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 cold.
Okay, great. All right, next I'm going to shine this light in your eyes.
Okay.
And just look right here at my nose.
Okay.
That's good. Good. Okay. All right, next I'm going to take a look at your chest, okay?
Okay.
And I'm going to feel around on you.
Okay.
And I'm going to feel your apical pulse.
Okay.
Okay, that's good. Next I'm going to check your other pulses, okay?
Okay.
Okay, that's good. Okay, that's good. While I was taking your pulse a second time, I was checking your respiratory rate. It's a little bit slower than usual. Is that normal for you?
Yeah.
Okay. All right, now straighten your legs out. I'm going to check the pulses in your feet and also behind your knees.
Oh, okay.
Okay. Good. Okay. Okay, good. And also I need to check the pulse in your groin. Is that okay?
Sure.
Okay, good. Let's check your capillary refill in your fingers.
Okay.
That's good. Good. All right, now I'm going to take a listen to your heart, okay?
Okay.
Okay, good. Now I'm going to take a look at your neck.
Okay.
That looks good. No jugular venous distension. All right. And when I was looking at your nails earlier, I didn't see any clubbing and no blue discoloration, so that's good. Next, I'm going to take a listen to your lungs. So if you could face that way. And first, I'm going to assess your breathing for symmetry. So go ahead and take a deep breath. And one more. Okay, good. Now I'm going to take a listen. All right, some deep breaths. Gonna listen on the sides now. Okay, you can go ahead and sit back. Now I'm going to listen to the front.
Okay.
Okay, good. All right, now you can lay down because I'm going to take a look at your belly.
Okay.
Do you have any cough with your shortness of breath?
No.
Okay, and how are your bowel movements?
Fine.
Are they pretty regular?
Yeah, like every day.
Okay, and you don't have any pain with those, any blood, anything like
No.
that? Dark tarry stools?
No.
Okay,
No.
good. All right, so your belly looks good. Gonna take a listen now. Okay, good. You've got sounds in all 4 quadrants. They're all normal. Just gonna percuss on you here. Okay. Now I'm going to feel around on you. Just tell me if it hurts, okay?
Okay.
Any pain with that?
No.
Okay, and do you have any nausea or vomiting?
No.
Okay, good. All right. So when I was looking at your hands earlier, I didn't notice any discoloration, no blue skin, which is cyanosis, no jaundice that I can see, which is yellowing of the skin. Do you feel like your skin is excessively dry or excessively moist?
No.
Okay, I was noticing earlier that it seems well moisturized.
Okay.
Do you have any changes in your skin that you've noticed, like rashes, changes in moles, scabs, any wounds, anything like that?
No.
Okay, let's check your scalp.
Okay.
Just gonna check your hair here. Do you have any thinning or patchy spots that you've noticed?
No.
No excessive dandruff or oil?
No.
Okay, good. Well, that looks good. And that is everything I needed to get from you. Is there anything else I can do for you?
No, thank you.
All right. Well, if you need anything, just press that call button, okay?
Okay.
Thanks.
Thank you.
Hello, my name is Kimberly Almada. I'm a KMHMP student at UTEP, and I will be performing a head-to-toe assessment. This is my patient. May I please have your full name and date of birth?
Dennis Guerrero, 11581.
Do you give me permission to record?
Yes.
Okay, I previously washed my hands, but I'm going to go ahead and apply Germex and gloves. I will start my assessment by checking my patient's mental status. She was able to give me her full name and her date of birth. Do you know where you're right now?
A clinic.
A clinic, and what are you getting done?
A physical assistant.
And do you know today's date?
December 4th, 2024.
Okay. Patient is alert and oriented to person, place, time, and situation. Now I'm gonna go ahead and check her language function. Can you just tell me how your day was today?
Very well, thank you.
Okay. I'm gonna go ahead and give you simple commands, okay? Go ahead and close your eyes. Okay, very good. Go ahead and open them. Now I'm gonna go ahead and ask to repeat the phrase no ifs, ands, or buts.
No ifs, ands, or buts.
Okay, now I'm gonna go ahead and show you objects and you let me know what they are.
Pillow. Stretcher.
Okay, very good. Her speech is fluent, it's accurate comprehension. She's correctly names the objects, and she's able to repeat the things. Now I'm gonna go ahead and test her short-term memory. I'm gonna name 3 objects, and then later on I'm gonna ask you to repeat them, okay?
Lab coat.
Stethoscope, lab coat, and watch. Okay, now I'm gonna go ahead and check her long-term memory. Do you know who the first president of the United States was?
George Washington.
Correct. Now if you could please count backwards by sevens, from 100 back by sevens.
100, 93, 86, 79, 72.
Very good. Do you remember what those 3 objects were?
Lab coat, stethoscope, and watch.
Okay, very good. She's accurate and quick when she was doing the calculation. I'm gonna go ahead and check her visual spatial processing. I'm gonna ask if you could please draw a clock of a face of the clock, and then put it for 3 o'clock, okay? I'm just gonna get a paper and a pen. And my patient was accurately able to do that. It was accurate and proportionate reproduction. I'm gonna go ahead and check for abstract reasoning. Now I'm gonna ask my patient, let me just put this down. How are apples and grapes alike?
They're both fruits.
Correct. Now I will assist the head and the neck. I'm gonna inspect the head and her skin, okay? And skin on the face as well. It is warm to touch. It is pink in color. I don't see any lesions or deformities. Now I'm gonna go ahead and inspect her scalp. It's normal cephalic, it's symmetric, they're atraumatic without any lumps, indentations, or any deformities, sorry. There's no nevi, I don't see any lesions, depressions. Her hair is evenly distributed. I don't see any dryness of the scalp. I don't see any bald spots. Now let me go ahead and check her face. Her face is symmetric. The lower eyelids are well positioned. I don't see any facial drooping. Her skin is intact. It's smooth texture. Her skin color pigmentation is accurate for ethnicity. I don't see any edema. I don't see any masses or lesions. Now I'm gonna go ahead and inspect the facial expressions, which is the cranial nerve number 7. I'm gonna ask if you could please raise your eyebrows for me. Very good. Now close your eyes tightly. Okay, now smile for me. Now puff up your cheeks. Good job. She has bilateral symmetrical facial expressions. Now I'm gonna go ahead and test sensation of her face, which is cranial nerve number 5. I'm gonna get an object. I'm gonna touch your face. Just let me know where you feel it, okay? And then after that, I'm gonna check for sharp and dull. Okay, I'm gonna ask if it's sharp or dull or soft. Okay, let me just get my objects here. Close your eyes for me. Now just tell me where you feel it. Really good. Now tell me what you feel.
Dull. Sharp. So.
Okay. Now I'm gonna go ahead and palpate her temporal and her masseter muscles. Okay, so I'm gonna check the temporal and the masseter. I'm gonna ask if you could please clench that. Okay, and I don't feel any crepitus. It's intact. Sensation in all areas. It's strong. It's symmetrical. Muscle contraction. There's no motor weakness. Therefore, cranial nerve number 5 is intact. Now I'm gonna go ahead and palpate the cervical lymph nodes. Okay, I'm checking. Just palpating. Just tell me if you feel any pain. The subclavicular. No tenderness. Okay, so the patient denies any tenderness. The cervical lymph nodes are not palpable, which is a normal finding. There's no enlargement, no firmness or tenderness noted, and she also denied that. Now I'm gonna go ahead and examine the trachea. So I'm looking for the trachea, which it is midline. It's not deviated, and I'm gonna go ahead and auscultate breath sounds over the trachea. So like I mentioned earlier, her trachea is midline and has no deviation. The patient's breath sounds over the trachea are clear and equal. There was no stridor or abnormal sounds noted. Now I'm gonna go ahead and examine her thyroid gland. Okay, now I'm gonna go ahead and give the patient a cup of water. I'm gonna go behind you. I'm gonna ask for you to swallow. Just give me a second, okay? Just go ahead and palpate the thyroid. Go ahead and swallow. Okay, very good. The thyroid gland is not visibly enlarged. On palpation, it is smooth, symmetrical, and normal size. It has no palpable nodules or tenderness. The consistency is soft and pliable with no signs of irregularities. Now we'll continue with assessment of her eyes. I'm gonna start my assessment by just checking the eyes, okay? The eyes are symmetrical. There's no protrusion. I don't see no deviation. The eyes are properly aligned and positioned symmetrically. There is no visible strabismus noted. The eyelids cover the corneas symmetrically, and there's no visible misalignment or abnormal positioning either. Now I'm gonna just inspect her eyebrows and her lashes and the lacrimal glands as well. Her eyebrows are full and the lashes as well. I'm gonna just remove your lenses, okay? The lashes are full as well. I don't see any edema or lesions. The eyelids are symmetrical. Now I'm gonna check the lacrimal gland, okay, which I don't feel any swelling, any tenderness. No lumps, no swelling. There's no excessive tearing of the lacrimal gland. Now I'm gonna go ahead and inspect her conjunctiva and her sclera. First I'm gonna inspect the sclera. I'm gonna ask you to just move your eyes one side, now the other. Look down for me and up. Her sclera is white in color. Now her conjunctiva, it is pink in color. There's no redness. I don't see any foreign objects. I don't see any discharge. Nothing abnormal. I will continue testing the optic nerve, which is nerve number 2. I will use the Snellen chart for that. Since it is handheld, I could be 14 inches from my patient. I'm gonna ask if you wanna go ahead and put on your glasses for me. Okay, so cover one side of, and read the smallest line.
LTF page.
Okay, now go ahead and cover the right eye and read for me.
LTF page.
And she does have 20/20. Now I'm gonna go ahead and check her peripheral vision. Okay, just tell me when you see it. Okay, so it's visual fields in all quadrants and it's intact. Now we'll go ahead and test the pupil size. I'm gonna be checking her symmetry, and this is checking cranial nerve number 2 and 3. Now I'm gonna flash a light in your eyes, okay? If you wanna go ahead and remove your lenses for me, just look straight. There is gonna be a bright light in your eyes, okay? Okay, which does constrict. Now the other side, very good. Now I'm gonna check the light on this side, but I'm gonna make sure the other side is constricting, which it did. Now on the other side, very good. So pupils are equal in size. They're approximately 3 millimeters round, and they're reactive to light, and they accommodate. Now I'm gonna ask if you could just follow the pen line, and they converge, okay? And if they're symmetric. I will now test cranial nerve number 3, 4, and 6, which is the extraocular movements. I'm checking for any weakness or nystagmus, and I will do this by the 6 cardinal signs of gaze. So I'm gonna ask if you could just please follow my pen line, okay? Really good. Both eyes are bilaterally moved. There was no involuntary eye movements or nystagmus present. There is full range of motion without any restriction or lag, and there is no ptosis noted. Now we'll continue my eye examination. I'm going to go ahead and use an ophthalmoscope. And this one I'm checking her cornea, her iris, her lens, her optic disc, and cup, retina, and retinal vessels. Okay. Let me just turn on the light. Okay, just look straight. And I see the red light. Okay, now I'm gonna go ahead and check the other eye. And I also see the red light. The cornea is clear. There's no opacity or cloudiness. The iris is evenly colored with well-defined borders. Perla is present. The lens is transparent with no visible opacities. The chambers appear normal in depth and has no signs of accumulation of fluid or any irregularities. There's no bulging. I didn't see any blurred margins, pallor, or cup enlargement. I will now go ahead and move to the ears. Before I start seeing her hearing, I'm just checking the outside of it, which is, I don't see any lesions, no abrasions, it's not red or anything. I'm gonna go ahead and move with the whispering test. Okay, I'm gonna cover your right ear and I'm gonna whisper over it. I'm gonna ask you to see if you heard it.
Purple.
Okay, then I will do the Weber and Rhine test. This is checking cranial nerve number 8. Okay. Let me know if you hear it equally on both sides, okay? Okay, that was the Weber. Now I'm gonna go ahead and check for the Rhine. That's the right test. Okay. The patient is able to hear the whispered words. She had no difficulty in hearing or understanding the whispered words. The Weber test was she heard it equally, bilaterally, and the right, the air conduction, bone conduction, all were normal findings. Now I'm gonna go ahead and now I'm gonna inspect. I'm just gonna get my ophthalmoscope and I'm gonna inspect the tragus, the auricle. I'm checking any lesions or any abnormalities. No pain. Okay, and there's no swelling. Okay, now I'm gonna go ahead and check her ear canal. Let me just cover here. Since she is an adult, I'm gonna pull her ear up and back. Okay, and I don't see any redness. I don't see any swelling. There's no cerumen present, and her tympanic membrane is pearly gray and it is translucent. I didn't see any bulging either. Now I'm gonna go ahead and check her left ear. I'm gonna go up and back since she is an adult. No redness, no swelling, no foreign objects. There's minimal cerumen noted, and her tympanic membrane is pearly gray and translucent. I didn't see any bulging of the membrane. It's smooth. No abnormalities present there. Now I'm gonna go ahead and inspect I'm gonna go ahead and move to the nose now. So I'm checking for symmetry. I'm gonna remove your lenses. I do apologize. Okay, I'm just checking for symmetry. No pain, nothing. Okay, and it is symmetric. Now I'm gonna go ahead. I'm gonna be checking the inferior surfaces. I'm gonna check the nasal mucosa, the nasal septum. Okay, I'm looking for if anything is asymmetric. Okay, just go ahead and look up. Okay, and they're moist. redness, no polyps. Her septum is in the middle, it's not deviated. There was nothing. Now if you could just breathe, hold one nostril and breathe in, and then the other side, which are patent. The nasal appears intact. Though there was no swelling or abnormalities noted. It was pink and moist. There was no lesions. The nasal septum is straight and it is not deviated or perforated. The inferior and midline turbinates are smooth and free of polyps and any abnormal growths. The meatuses are not obstructed and they're symmetrical. There was no visible abnormalities like I have mentioned. Now I'm going to go ahead and palpate the maxillary and the frontal sinuses. Let me know if you have any discomfort or any pain, okay? No? Okay, patient denies any tenderness or pressure. The sinuses are non-tender upon palpation, and there are no signs of swelling either. Now I'm going to go ahead and test her olfactory nerve, which is the first cranial nerve. Okay, I'm going to ask for you to close your eyes, and I'm going to ask you to see what you smell. Correct.
Garlic salt.
Okay, and the patient was able to identify all of the scents correctly. I will now examine the mouth, the pharynx, and the throat. So her lips are symmetrical, they are moist, they are pink. I don't see any dryness or any like lesions. I'm gonna ask if you could, let me get my pen line, I do apologize for that. Go ahead and open your mouth. Okay, the buccal mucosa is moist, it is pink. Her teeth are intact. I don't see any redness or swelling. I don't see any open wounds or any blisters. Now I'm gonna ask for you to stick out your tongue. I want you to say ah. Okay, and I just checked cranial nerve number 9 and 10, which are intact. Her uvula is and soft palate is midline, and it does go up when she said ah. Now I'm gonna go ahead and check cranial nerve number 12. Since I'm already here, I'm gonna ask if you could stick out your tongue. You're gonna move it side to side for me. Okay, now against resistance. On the other side. Okay, very good. The tongue is midline. There's no lesions or atrophy, no erythema. There's no discoloration, no nodules or deformities. Equal tongue movement. The strength was good, and it wasn't deviated or fasciculations. Now I'm gonna go ahead and assess the. Now I'm gonna go ahead. So since she was able to say ah, I did check for the speech. There was no tonsillar enlargement when she said ah, and there was no swelling difficulty either. Her speech her voice quality was fine. It was clear, fluent, well articulated. There was no signs of slurring, nasal speech, or abnormal voice quality. So I've tested several cranial nerves. Now I'm going to continue with my neurological assessment. I'm assessing the motor system, the involuntary movements, any muscle bulk, muscle tone, and the pronator drift. Okay, now I'm just going to go ahead and place this here. Okay, I'm going to go ahead and test cranial nerve. I'm so sorry, so the neurological assessment is also, I'm going to combine my musculoskeletal assessment since it's very similar. Okay, so I'm going to be checking her neck. So like I said, there was no lumps, anything. I'm going to ask if you could put your head forward and then back and then lateral to the sides. Now against resistance. Very good. Now the other. Okay, now I'm gonna, which was good, 5 to 5 on the strength. I'm now gonna go ahead and check cranial nerve number 11. I'm gonna ask you if you could shrug your shoulders. Okay. Now I'm gonna go ahead and ask you if you could put your arms forward. Okay, now against resistance, push up, now push down. Very good. Now we could do the flexion of your shoulders. Side. Now you're gonna do this. And this. Okay, very good. There was no involuntary movements. Now I'm gonna go ahead and move. I'm gonna continue my assessment. I already asked her to shrug her shoulders, which was good. Now I'm gonna go ahead and check. I already checked the abduction, which it was fine. She has great ROM, range of motion. The patient was able to do, now I'm gonna check for elbow flexion, okay? If you could just go like this, very good, okay? Then, let's see, against resistance, push up, good job, not bad. Okay, so it's strong, it's 5 out of 5, and it's symmetrical elbow flexion and extension on both sides. Now I'm gonna go ahead and move to her wrist and her radial nerve. So her wrist, I don't feel any swelling, I don't feel any crepitus, her fingers are good. Her capillary refill is less than 2 bilaterally. Go ahead and do this for me, and then push up. Okay, now push down. Very good. Can you do this? Very good. Now do this. Can you extend your thumb? Very good. And then forward. Okay. So it's intact. Her range of motion is good. They're pretty strong. 5 out of 5. They're symmetrical. She did the finger flexion and extension on both hands. Now I'm gonna go ahead and move to her hip flexion. I'm gonna ask if you could please lay down for me. Okay, so I'm just checking your hips now. I'm gonna just go like that. Any pain? And I don't hear any popping noises or anything. She's able to move her legs good. Now I'm gonna ask if you could abduct. I'm gonna move your leg out of the way. Now this one, please. Okay, and then if you could abduct, put it forward. Very well. Now the other side. Now I'm gonna go ahead and check her gluteus maximus. I'm gonna wait. Before I do that, I'm gonna see if the resistance go up. Very good. Down. Very good. Now go ahead and go on a prone position for me. I'm gonna be checking the gluteus maximus right now. Now I'm gonna just ask if you could lift up one leg and then the other one. The other one. Good job. Now against resistance, okay? Go ahead. And then down. Very well. Now I'm gonna go ahead and check for knee flexion. If you wanna go ahead and stand up for me. Okay, first I'm gonna go ahead and palpate. I don't feel any swelling, no deformities, any pain. No, I'm gonna ask if you could just extend your legs. Very good, and then back. Okay, now with resistance. Very good, very good. Now I'm gonna go ahead. They're 5 out of 5. They're symmetrical. Her knee flexion and extension on both sides. Now I'm gonna go ahead and move to her ankle and dorsiflexion. Okay, so I'm just checking her ankles. I don't feel any swelling, any deformities. Her feet feel good. You could put your feet down and then touch the roof. Okay, now with resistance. Forward. If you could abduct them. Abduct. Okay, so it's really good. Now move your fingers for me. Very good. Now I'm gonna ask if you could please like this. And then the other side. Now we're gonna test the rapid alternating movements. If you could just do this for me, fast. Then your fingers. Very good. Now I'm gonna check I'm gonna ask if you could touch your nose and then touch my finger. Then touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, my finger. Okay, I'm gonna go ahead and ask if you could please sit up for me. Stand up, sorry. Now I'm gonna ask if you could please walk normal that way. Very good. Now if you could come back with tiptoes, tippy toe, there you go. If you could walk back on your heels. Okay, and her gait is well balanced. It's smooth, accurate, coordinated movements. And then now I will test the Romberg test. If you want to go ahead and come over here so I can see you. You're going to place your fingers like that with your eyes open. Her gait is steady. Now if you want to go ahead and close up for me. And then with resistance, she's able to maintain a steady gait. Now I'm gonna go ahead and check her spine. Okay, go ahead and open your eyes. You're gonna just bend down, touch your toes. And her spine is midline. I don't see any scoliosis. We'd normally be able to see it. And her iliac is symmetric. Okay, okay, ma'am. Now I'm gonna go ahead and check for the sensory system. I'm gonna go ahead and take a seat. I'm gonna do light touch, pain, and temperature. Then I'm gonna also check for vibration, see if she feels that, and the discriminative sensation, okay? I'm gonna start with light touch. Okay, now just tell me you feel it. Feel it? Okay, and she's able to feel that. Now I'm gonna go ahead and check vibration. Okay, which she is able to feel the vibration. Now I'm gonna check for pain. Let me know if it's painful, okay? Painful? Yes. Okay, so that's intact. She's able to feel that. Now I'm gonna check temperature. Let me know if it's cold or hot. Okay. Cold. Okay, and she's able to differentiate between cold and hot. And then I'm gonna ask if you could close your eyes, put your hands forward, and let me know if I put your finger up or down. Okay, I'm gonna go ahead and now and check her discriminative sensation, which is called sternocleidosis. I'm gonna place an object in her hand. Okay. Close it and let me know what you feel. Which is correct. Now let's see this hand. Correct. The patient can correctly identify the object by touch. Now I'm gonna check graphesthesia. With the patient's eyes closed, I'm gonna draw either a letter or a number and see if she could appropriately distinguish. Close your eyes for me.
8.
Correct?
8.
Correct. Now I'm gonna go ahead and check the patient's reflex. I'm gonna check the biceps, the triceps, and the brachioradialis, the patellar, and the Achilles reflexes. Do the biceps first. Very good. Now the other side. Okay, now the triceps. Very good. And the brachioradialis. Good. Very good. I love the top. Good job. Okay. And all reflexes are present. They're 2+ bilaterally, okay? Now we'll go ahead and move on to my respiratory assessment. So my patient is sitting upright. There's no acute distress. I don't see her using her muscles. Anteriorly is symmetric. She's breathing. Her breath sounds are not unlabored. I am counting with my watch, and they're around 16 breaths per minute. Now I'm gonna go ahead, and I don't see any deformities. I didn't see any muscle retraction or any bruising. I'm gonna go ahead and start with percussion. I'm gonna percuss anterior and posteriorly, okay? Other side. Okay, now I'm gonna go ahead and do the same posteriorly. Okay, normally, I mean, of course you would do this, the skin, but for her privacy, we are leaving the shirt on, but I could still feel that it is tympanic all around. Posterior, anterior, posterior, it's resonant sounds over all the lung fields. Now I'm gonna go ahead and move to palpation. I'm gonna palpate, and then after that, we're gonna check for fremitus, okay? Okay, I'm palpating for any masses. Are you any tenderness? Any pain? Okay, which she denies any tenderness or pain. I don't feel any masses or any lumps. There's no crepitus either. Any tenderness? She denies posterior as well. And I'm gonna go ahead and check for fremitus. I'm gonna ask if you could repeat 99.
99,
Okay.
99, 99, 99, 99, 99,
Okay. I'm gonna go ahead and do that anteriorly.
99, 99, 99, 99, 99, 99, 99.
Okay, very good. I did feel a vibration. I'm gonna check for her lung expansion, anterior and posterior. Okay, anterior. If you could just take a deep breath. Okay, and she has good lung expansion, and it's symmetric. My thumbs did meet. They expanded and met. Okay, go ahead. Again, for posterior, the same findings as anterior. There's no tenderness. I didn't feel any masses. No asymmetries, and the fremitus was normal. There's equal lung expansion bilaterally, anterior and posteriorly. Now I'm gonna go ahead and auscultate. I'm checking for any wheezing, any rhonchi, or any heart sounds or any adventitious sounds. Okay, again, my stethoscope might be cold, okay? So let me try and warm it up. Every time I move it, just go ahead and take a deep breath, okay? Okay, no adventitious sounds for her anterior. Of course, for her privacy, we are leaving the shirt on, but of course you would check with skin, the stethoscope to the skin. I'm checking posterior. Go ahead and take a deep breath. Deep breath. Deep breath. Deep breath. Okay, and posterior, there was no wheezing, rhonchi heard, no adventitious sounds. Now I'm gonna go ahead and check for voice sounds, if there are any abnormal transmitted voice sounds. I'm gonna ask if you could please say 99.
99, 99, 99, 99.
Okay, and there was no abnormal voice sounds transmitted, which is the normal finding. Now I'm gonna go ahead and move to my cardiovascular assessment. I'm gonna start first by checking the patient's blood pressure. Which is 122/64. Now I'm gonna go ahead and palpate her brachial pulse and her radial pulse. I'm checking for any heaves or and I have my watch here and I'm checking to see the pulse. Okay, 30 minutes times 2, which is 68 is her heart rate, and they're strong. It's 2+ bilaterally, the brachial and the radial. I'm gonna go ahead and move to her carotid arteries. I'm gonna go ahead first and palpate. I'm feeling for any let's see. Take a deep breath and then let it out. And then, okay, no bruise. Upon palpation, I don't feel any thrills. Now I'm gonna go ahead and check this side. Take a deep breath and let it out. And okay, and no bruise are present. The jugular vein is not distended on either side. Again, the aorta, I didn't hear any bruise, I didn't feel any thrills. Now I'm gonna go ahead and check for the apical impulse. I'm gonna go ahead and ask if you could please lay down for me, and you're gonna lay down on your left side since it's where you could palpate it, you could feel it the most. Okay, I'm just gonna raise your shirt, okay? Okay, there's no abnormal pulsations there. Now you could please lay on your back. I'm checking for heaves or any thrills, okay? Just palpating here, which I don't feel any heaves, which is a normal finding. Now I'm gonna go ahead and the PMI was located, which is in the midclavicular line on the 5th intercostal space. Now I'm gonna go ahead and auscultate the heart sounds, S1 and S2. I'm gonna be using the bell, both sides actually. I'm gonna start with the aorta, which is in the second intercostal, it's in the right intercostal space, second intercostal space. Okay, now I'm gonna go ahead and move to the second intercostal space on the left side, which is near the sternal border, and this is the pulmonic aorta. Okay, now I'm gonna go ahead and move to the third intercostal space, and this is the Erb's point. Okay, now moving to the tricuspid area, which is on the 4th intercostal space, and it is near the sternal border. Okay, now I'm checking the mitral area, which is the apex, and that's on the 5th intercostal space on midclavicular. Just gonna raise it right here. Okay, and I was able to hear S1 and S2. I didn't hear any S3 or S4. I didn't hear any other sounds. I didn't hear any extra sounds or any murmurs. Now I will examine the abdomen. I'm gonna go ahead and go to the right side. Okay, with the abdomen, I am inspecting the liver, the spleen. I'm checking her kidneys, the bladder as well. Now, first I'm gonna start with inspection. I'm checking to see how it looks, which it is flat. It is warm to touch. The abdomen appears flat. The skin is smooth. I don't see it's uniform in color. I don't see any striae. I don't see any lesions or any abnormal. Anything abnormal. Now I'm gonna go ahead and check for any hernia or any bulges, and by that I'm gonna ask if you could please lift your neck up. Okay, which I don't see any hernia or bulges. Now I'm gonna start with auscultate. I'm gonna auscultate the aorta and then I'm gonna check the aorta, and then I'm gonna check the renal and the iliac arteries. Okay. So that's the aorta. Now I'm checking the renal arteries. Now the iliac arteries. Okay, now I'm gonna go ahead and auscultate all 4 quadrants. You always want to start auscultating so you don't disturb the bell sounds. I'm gonna start with the right lower quadrant. Okay, and the bell sounds were heard in they're present in all 4 quadrants. They are normal active. You could hear the gurgling, usually 5 to 30 per minute. There is no bruise heard on the arteries. And I'm gonna go ahead and percuss now, all 4 quadrants. With my pleximeter finger. And as I move, it's tympani all around. It's tympani, and it's due to gas in the intestines. There's dullness over the liver and the spleen. Now I'm gonna go ahead and start with palpation. I'm gonna start light, and then I'm gonna do a deep palpation. So I'm just doing light with one finger. Any tenderness, any pain. Okay, now I'm gonna go ahead and do a deep palpation with both hands. Any pain? No? The patient denies pain or tenderness. The patient, there was no guarding or rigidity. There was no rebound tenderness, no masses or pulsations noted. Now I'm gonna go ahead and percuss the liver. Let me go ahead and get a measurement because I am gonna be measuring the liver as well. And you could hear where it goes from tympani to dullness. Okay, and that's usually, it's like 6 to 8, which is a normal finding. Now that is, the liver is placed on the right side, midclavicular line, okay? Now I'm gonna go ahead and percuss the left upper quadrant, and I'm checking the spleen for the enlargement, and I am checking on the trough side first. And that's to detect if there's any splenic enlargement. I'm gonna ask if you could come a little bit this way. Okay. Go ahead and go on your back. The liver and the spleen are not palpable, which is a normal finding. There's no enlargement. Now I'm gonna go ahead and check her kidney and urinary bladder. I'm gonna go ahead and palpate the bladder. Gonna palpate your bladder for any distension, any pain. And I don't feel any bulginess of the bladder. I don't feel it protruding. I don't feel any masses. Now I'm checking the kidneys, which should be here, but those shouldn't be palpable. Any pain, which they're not. Now I'm gonna go ahead and check for claustrovibral angle tenderness, which is CVA. I'm gonna ask if you could please sit on the edge of the bed for me. And this is on the under the 12 intercostal space. And I'm gonna percuss. Let me know if you have any pain.
No.
Okay. The patient denies having any tenderness, which is there's no kidney inflammation or no infection. Okay. Finally, when I did the neurological assessment, I did check for the musculoskeletal assessment. She has range of motion throughout all areas, but I'm gonna go ahead and palpate her shoulder girdle. I'm checking for any abnormalities. There's no crepitus there. And then her elbows, I don't see no lesions. Her elbows, I don't feel no swelling, any pain. No. Her patella, either there's no pain, no swelling, no deformities, and her ankles as well. The only thing I did notice is that the patient does have a bruise, but there's no pain, and she was able to perform all tests with no issues. Thank you so much for your time, and this will conclude my head to toe. Thank you so much.